Taking care of your mental health while living with chronic kidney disease. CKD can affect a person's mental health in several ways. For example, it can make a person feel physically unwell, which may hurt their mental health and how they respond to stressful situations. Depending on the stage of a person's CKD, they may face certain stresses that can impact their mental health. They may have to change multiple elements of their life, which may feel overwhelming. Hemodialysis is a treatment for CKD. During this procedure, a person's blood passes through a filter in a machine that acts as healthy kidneys would, removing waste and any extra water and salts from the blood. Research suggests that up to 50% of people having dialysis treatment experience symptoms of anxiety and depression. The American Kidney Fund states that stressors associated with dialysis may include 1. The time commitment for dialysis, 2. Feeling like a burden to others, 3. The financial cost of the treatment, 4. The fear that dialysis may cause pain, 5. Worrying about how dialysis may impact a person's work, social life, family, love life, 6. Not being able to get good quality sleep, 7. Eating restrictions, 8. Changes in employment. Common mental health conditions. Depression and anxiety are two mental health conditions that medical professionals associate with CKD. Depression. Depression is common among people with chronic illnesses, including CKD. Common symptoms of depression include feelings of hopelessness, pessimism, irritability, frustration, restlessness, guilt, worthlessness, helplessness, and a loss of interest or pleasure in hobbies and activities. Sleep problems, fatigue, physical aches and pains such as headaches, and difficulty remembering things, concentrating, or making decisions are also common. Changes in appetite, unintentional weight changes, and suicidal thoughts can occur as well. If a person experiences depression symptoms for at least 2 weeks, they should speak with a healthcare professional. Anxiety, occasional feelings of worry, are a typical part of life. However, a person may have an anxiety disorder if they experience anxiety symptoms that do not go away or get worse over time. Common symptoms of anxiety include feeling on edge, irritable, restless, wound up, fatigued, having difficulty controlling feelings of worry, having difficulty concentrating, and aches and pains that may not have an obvious cause. Sleep problems are also a common symptom. If you or someone you know with CKD think you may be experiencing depression or anxiety, they should speak with a doctor. Treatments for depression. Medical professionals tend to treat depression with psychotherapy, medication, or a combination of both. Common treatment options include antidepressants, which change how a person's brain produces or uses certain chemicals that play a role in mood or stress to help reduce symptoms of depression. Cognitive behavioral therapy, or CBT, helps a person adjust their behavior by changing their thinking patterns. It may help a person with depression identify negative thoughts that may worsen their symptoms and implement changes to reduce the impact depression has on their life. Interpersonal therapy, or IPT, helps a person with depression identify and address problems in their relationships with others. It may help reduce symptoms of depression. There are treatments for depression and anxiety. Treatments for anxiety. Similar to depression, doctors often treat anxiety with medications, psychotherapy, or a combination of both. Medications that a person may take to treat anxiety include anti-anxiety medications, which may help reduce a person's anxiety symptoms, as well as panic attacks and extreme fear or worry. Beta blockers may help treat physical symptoms of anxiety, such as a rapid heart rate, blushing, trembling, and shaking. Antidepressants may help improve anxiety symptoms by helping manage how a person's brain uses certain chemicals that control mood or stress. Healthcare professionals may also recommend therapies such as CBT and acceptance and commitment therapy, or AET, to treat a person's anxiety symptoms. During CBT for anxiety, a person may undergo exposure therapy, which is a CBT method that may help a person confront fears that are contributing to their anxiety. This may help them engage in activities that they have avoided to help reduce feelings of anxiety. A person with anxiety may also benefit from ACT, which uses mindfulness and goal setting to help reduce a person's symptoms. Researchers are still evaluating its efficacy. Lifestyle changes a person can make to improve their anxiety symptoms include exercising regularly and trying relaxation techniques such as Pilates, breathing exercises, and yoga. Avoiding caffeine, alcohol, smoking, and drugs can also make a significant difference. Effective ways for a person with chronic kidney disease to manage their mental health include learning mindfulness techniques like yoga, deep breathing, and meditation. Spending time outside in nature can be very beneficial. It's also important to surround yourself with community and connect with others who have kidney disease. Engaging in creative activities can help unleash your inner artist. Volunteering and helping others can improve an individual's mental well-being. Playing with a pet, exercising, and eating healthy are also effective strategies. For more information, please visit https://www.kidney.org/news-stories and https://w.medicalnewstoday.com.